Today, I'm delighted to be joined by Professor Leon Lack. Professor Lack is Emeritus Professor at Flinders University in Australia. He's a clinical psychologist as well who treats insomnia and circadian rhythm disorders at the Adelaide Institute for Sleep Health. Dr. Lack earned his PhD from the University of Adelaide and received his Bachelor of Arts from Stanford University. He is acknowledged internationally as one of the world's leaders in circadian rhythms and the behavioral management of insomnia. He's published over 200 scientific articles, book chapters, and books since 1980. He's received many large research grants from the Australian Research Council and National Health and Medical Research Council. For the last 30 years, he's also directed a clinic for the non-drug treatment of insomnia at the Adelaide Institute for Sleep Health, and he supervised many clinical masters and PhD students in the area. He was a co-founder of the Australasian Sleep Association, where he was president from 1989 to 1992. And he's also the founder of ReTimer, which is a wearable light therapy device that I have here, which we are going to be talking about today. We're going to be talking about bright light therapy for sleep disorders, the indications. He's also giving us a masterclass in the circadian rhythm and body clocks. If you're a clinician, this class is for you. This took me back to my university and med school days, and I was just absorbing all of the information that Dr. Lack was teaching us. So you're really going to enjoy this, especially if you're a lifelong learner like me. So we're going to be looking at bright light therapy. If you're a physician, you want to up-level your sleep medicine knowledge, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. We also talked a little bit about melatonin. We didn't get too much into that today. We were mostly focused on bright light therapy, but if you want to learn more about using melatonin in your practice, you can get my free melatonin brand guide at IntraBalance.com/melatonin. All right, let's get into the interview. Professor Lack, thank you for joining me today. Can you tell our audience a little bit about your background and your research?
Thank you for having me on. Yes, my background is basically in biological psychology. I started that in my undergraduate years and continued on in teaching here at Flinders University in South Australia, teaching both biological psychology and getting an interest in sleep and biological rhythms very early on. And that's where a lot of my research has been located, particularly the interplay between our body clock, circadian rhythms, and sleep disorders. Realizing that there was that, and I'm still pursuing that same theme, trying to impress the population and my colleagues in the strength of circadian rhythms on our lives, not only our overall health, but more importantly, or most importantly, in when we feel alert and productive, as opposed to feeling sleepy and slow and unproductive. We go through these 24-hour rhythms in our body clock called circadian rhythms, circa meaning about and dn a day. They're referring to 24-hour rhythms that are built into our bodies, basically. And the biology and the understanding of the biology of this is very good, with a lot of research from different animal species and humans to understand the mechanisms that drive this body clock. What is not well understood by the public is how strong its influence is on us. And we don't really normally experience that influence in everyday life because our body clocks are, for most of us, most of the time, generally aligned with our body clock timing. That is that we tend to go to bed, we start feeling sleepy at about the same time every night, and we sleep across that period of 7 or 8 hours, and we wake up in the morning feeling a little bit slow to begin with, but gradually over half an hour to an hour, we feel more alert and productive, and across the day, we feel pretty good. And so we don't notice the strong effect the body clock has on us, except if we attempt to go on to something like a shift work in which we have to work across the nighttime from midnight till 7 a.m. or 8 a.m. in the morning, and then try to sleep during the day. And that's putting our behavior and our productive needs completely at odds with our body clock. And that's when you really do feel the strength of it. You feel like death warmed over, really, at 5 or 6 a.m. in the morning. And it's a struggle to stay awake. But then if you stay awake until 7 or 8 or 9 o'clock in the morning, and you go home to try to sleep during the day, you start feeling more alert and you have difficulty actually falling asleep, even though you've been awake for more than 24 hours. And that's because you're trying to sleep when your body clock is prepared for alertness and productivity. And across the nighttime, you're trying to stay awake and be safe and attentive to what you have to be if you are working as a nurse or a doctor in surgery, or you're an emergency worker and you have to drive your ambulance to a crash at 5 a.m. in the morning, you have to be productive, you have to be competent, and it's very difficult to be that way at that time. In fact, we find that a lot of automobile accidents, particularly those accidents where people drive off the road and at a high speed and crash their car and die, often occur across the nighttime. And so what I'm getting at is that normally across the nighttime, our bodies are prepared for sleep, and trying to oppose that is difficult. Sometimes we can experience that same desynchrony between our body clocks and what we want to do if we fly across time zones and we experience jet lag. That's the same process. So that's been my theme, really, is to try to get across to the general public how strong that is. Now, how does that relate to good sleep? The good sleep period in our body clock, for most people, is from about midnight to about 6 or 7 a.m. And allowing us to sleep at that time produces the best sleep, generally. But our body clocks can slip out of sync with the timing of our society, in which we're expected to sleep at nighttime and be productive during the day. Most of us have to wake up at 7 or 7:30 in the morning to get off to work or to go to school, or we have maybe family obligations or other obligations for the people. That society starts becoming alive at around 7:30, 8 a.m. in the morning. In fact, there are lots of really nice indicators of that. If you had a microphone that you held it over the city by, say, a drone, just sitting there a mile above San Francisco, for example, and steady in place, and you were able to get rid of the noise from the drone, but you had this microphone magically hanging over a city, you would see the noise levels in the city go through a perfect 24-hour rhythm, where the noise gets down to a lower and lower level, gets its lowest level about 4 or 5 a.m. in the morning. Occasionally you'll hear a siren of a police car maybe, or an ambulance, but otherwise the noise level hits its lowest point right then. And then the noise starts coming back up again, and it comes up to a pretty high level around 8:30, 9 o'clock in the morning. It levels out a little bit, drops a little bit in the early afternoon, goes up to its highest level then at about 4 or 5, 6 p.m. in the afternoon, and then starts dropping steadily across the night. And that perfectly replicates, in fact, the core body temperature rhythm in most of us across the 24-hour period. Now, the reason for the noise level variation, of course, is that our society becomes very busy during the day, particularly at rush hour traffic times, and it becomes very quiet at that time in the night because there are the fewest number of people out and about making noise. So our society goes through that 24-hour clock, and that's pretty essential because light is important for us to be able to navigate the real world. It was also important for us in our evolutionary development. We are not suited to performing outside in the dark in the middle of the night. We don't have very good vision or hearing or smell, so we are actually very vulnerable across the nighttime hours. And so to be out in the open at that time would be a selective disadvantage. We would get picked off and eaten, fall off cliffs and things like that. So it's better to be in a nice enclosed, safe place to sleep in a safe place. And our body clock has been organized to provide that because light has an effect on the timing of our body clock. So when we wake up in the morning, open our eyes up and get exposed to indoor lighting and then outdoor lighting soon after that, it tends to have the effect of pushing our body clock back a little bit earlier into the nighttime. If we are awake and it's light in the evening, it tends to push our body clock a little bit later, and that will tend to push our sleep always into the nighttime. So if our sleep period, driven by our body clock, drifts too late, it gets confronted by light in the morning, which will stop that drift to the late time and push the body clock back into the nighttime. If it drifts too early and it gets exposed to light in the late afternoon or early evening, the mechanism will push our body clock back into the nighttime. Through exposure to light in our eyes and a direct connection from our eyes to the central body clock in the brain, which is right behind the bridge of our nose, about 2 or 3 centimeters back in the middle of our brain. There are nerves from our eyes that are used to time our body clock. There are nerves from our eyes that provide us with perception and vision back at the back part of our brain. But there are little sort of collateral fibers from our eyes that go into the body clock and tell it that it's nighttime or it's daytime and it's light. And that mechanism is very well known and operates really nicely to force our sleep period always into the nighttime. In evolution, evolutionary development, that was an advantage for us because, as I said earlier, we would be at a select disadvantage if we were roaming about the plains of Africa in the middle of the night. And so it forced us to seek shelter into a safe place and become more protected at nighttime, and allowing us to then hunt and seek food and go about our business during the daytime when we had greater advantages and were less likely to perish. That mechanism is very well understood, but the strength of it is not well understood by the general public. I don't know if you are aware of media broadcasts that say it's really dangerous to stay awake a long time. Wakefulness increases sleep pressure to such an extent that across the nighttime, you are performing as if you are drunk, legally drunk. And so we should be very careful to get enough sleep and not experience sleeplessness. Those studies, the original study of that, where all that media started to come from, was carried out, in fact, by my ex-PhD student here in Adelaide, where he measured people's performance in a task under different levels of alcohol, blood alcohol, and also across a 30-hour period when they first woke up on one morning, across the whole day and into the nighttime and into noon the following day. So 30 hours of total sleep deprivation. What he found was that performance across the first day of this motor skill task, a bit like driving, was pretty good across that first day. And then performance started dropping precipitously at about 10, 11 o'clock at nighttime, and it got worse and worse across the night, down to its worst value at about 7 a.m. in the morning. And he published that data, and that bad performance about 7 a.m. in the morning was equivalent to having about a 0.10 blood alcohol level in terms of performance, and that illustrated how important sleep was to our performance, that it should be considered seriously, as if we were performing as if we were drunk, basically, and should be legally lose our license. But he didn't report the last 5 hours of that study, which was from 7 a.m. until noon the following day, and when the participants were still fully awake, and so they were still losing sleep and still becoming more and more sleep deprived. But performance started coming up after 7 a.m. To 10 a.m. It was better than at 7 a.m. And at noon, it was much better than at 10 a.m. and much better than at 7 a.m. And at noon on the following day, 24 hours of being awake since noon the previous day, performance was only slightly less than 24 hours earlier. So that was really the effect of sleep loss over 24 hours. It did have a significant effect, but not a huge effect. The huge effect came from the circadian rhythm effect across the nighttime. That's when performance is really impaired. And so the title of the article, The Detrimental Effects of Sleep Loss, was a misinterpretation of the experiment. The interpretation should be the detrimental effects of performing across the nighttime when your circadian body clock is at its worst. And so those hours are to be avoided. It's not sleep loss so much that was contributing to the performance. It was the circadian rhythm effect. So my whole theme is to try to get that new message to counteract when my PhD student tried to impress the world about the importance of sleep. I'm trying to reshift that emphasis and impress the world of the importance of our circadian rhythms and how strong the effect is on our alertness and our productivity and our sleepiness and impairment. How does this relate to sleep difficulty? It started to become obvious to me maybe 20 years ago or so that there are certain types of insomnia. Now, what is insomnia? It's difficulty falling off to sleep, difficulty staying asleep across the night, waking up a lot, or waking up too early in the morning. So those are the sleep symptoms of insomnia, but they have to be accompanied by a chronic malaise to some extent, feeling fatigued, not sleepy, strangely enough. People with chronic insomnia don't feel they would like to feel sleepy, but they feel instead tired in the sense of fatigue. They just feel like they don't have any energy any longer, and that to do anything takes more sort of motivation to get yourself going to do it. But most people who have chronic insomnia, if you looked at them from the outside, you'd be surprised that they had any difficulty during the night sleeping. Because if your own sleep was disrupted like that, you would start feeling sleepier and sleepier. And experiments have been done to show that. If you interrupt people's sleep in the same way that chronic insomniac sleep is interrupted, you start getting really struggle to stay awake across the day. Chronic insomniacs don't struggle to stay awake. In fact, they would like to be able to have a nap and catch up on their sleep, but they can't. They just don't feel sleepy at all, but they feel fatigue instead. We feel that fatigue comes from their more of a sort of fight or flight mechanism getting triggered off at nighttime when they are frustrated and annoyed or worried that they're not going to be able to get back to sleep or get off to sleep in the first place. And so that stimulating the alerting system of fight or flight mechanism because of seeing a challenge takes its toll in feeling fatigue the next day. All right, so chronic insomnia is difficulties getting to sleep, staying asleep, and feeling fatigued, distressed, mildly depressed. If you experience this over a long period of time, anybody would start feeling depressed, and which they experience as well. But certain types of insomnia we identified as being related to body clock mistiming. And the major and most common type is difficulty falling asleep. There are some people who say, look, I just can't get off to sleep, and I end up not being able to get to sleep until 1 or 2 a.m. in the morning. I go to bed at a normal hour, maybe 11 p.m., and I'm just feeling alert, and I lie in bed, and it's now half an hour after I turn the lights on. I'm still awake. I'm feeling really frustrated and starting to get worried that if I don't get to sleep soon, I'm not going to get enough sleep because I know I have to wake up at, say, 6:30 in the morning. And so the longer it takes to fall asleep, the less sleep I'm going to get. That's going to impair me even more. And so that's a source of frustration. You start getting more worried and worried. And of course, if you have a lot of experience of that night after night, then just going to bed and trying to sleep automatically triggers off an arousal response. And that makes it more difficult to get asleep. And they're in the position of developing chronic learned insomnia, which then has to be treated. But that type of insomnia, difficulty getting off to sleep, with not much difficulty once they are able to initiate sleep. So they finally fall asleep, let's say at 1 a.m. in the morning. They have to wake up at 7 a.m. in the morning. They only get 6 hours of sleep, but they sleep pretty well from 1 a.m. to 7 a.m. They lose sleep across the week, and then on the weekends, they try to catch up on their sleep. How do you do that on the weekends? We don't have to go to work. You're able to sleep in later in the morning, aren't you? So on Saturday morning, Sunday morning, they catch up on their sleep, and they sleep until 10 or 11 o'clock in the morning, and they feel a bit more rested at the end of the weekend, but unfortunately, their body clock now has been affected, and they have more difficulty getting to sleep on Sunday night. Those cases that I've just tried to paint a picture of, we have found are associated with a body clock that is delayed, maybe 2 to 3 hours in its timing. And remember the earlier experiment I said that was done across 30 hours of time. Performance started dropping off remarkably at around 11 p.m., midnight, and that was due to the change of the body clock going into its sleep mode, out of its alert mode. And that normally helps us to fall asleep at that time in the evening. But for people that experience this sleep onset insomnia, their body clock has become delayed so that the period of time in the early evening, when most people are still quite alert and bright, that period in the body clock has now delayed, and it's the period from, say, 9 p.m. till 1 a.m. in the morning, and that inhibits their ability to get to sleep. Their body just isn't ready to fall asleep yet, not until 1 or 2 a.m. in the morning. But of course, it's still ready to sleep on later in the morning, and that allows them to sleep quite late in the morning when they are allowed to do. And that's a good indication that type of insomnia, that type of chronic insomnia, is related to a delay in the body clock. And that's not an uncommon type of insomnia to have. All right, so if the delay of the body clock is at least contributing to this chronic insomnia, there are other contributors too, like I suggested, a conditioned arousal response, but that's always going to be present to some extent. But if the basic cause of the difficulty was body clock becoming delayed, so that alert zone is now lying over the period in which you're trying to fall asleep, then how do we retime the body clock? The good news is we know how to do that. And research over the last 20 or 30 years has shown, and some of our own research has been used to show the same phenomenon, that exposure to light is probably the strongest tool to use in retiming the body clock. And that's what I was suggesting in our evolutionary development, is that exposure to light during the daytime pushes our sleep period into the nighttime. Whether or not it becomes delayed, pushes it back into the night, or it is too early, pushes it later back into the nighttime. In the case of this sleep onset insomnia, where their body clock is delayed by 2 or 3 hours from normal, creating difficulty getting off to sleep, but no difficulty maintaining sleep, and no difficulty sleeping till noon when given the opportunity. That exposure to light in the morning, soon after waking up, has the effect of shifting the body clock a little bit earlier, nudging it earlier. The brighter the intensity of the light, the more stronger the effect. The longer the period of light exposure, the stronger the effect. And very importantly, the color of the light. We know that broad spectrum white light, as in the sun, is effective, very effective. But what are the frequencies of what are the wavelengths of light, or the color, to use a more common terminology? technology, what color of light is most effective? We started researching this in the late 1990s because we realized that light-emitting diodes, LEDs, were very efficient converters of electricity into light, and they were being used in lots of electronic devices as indicator lights on your computer and so forth. But of course, LEDs have taken over the lighting world entirely now because of their efficiency and their low use of electric power and high conversion of power into light. So instead of having a 100-watt incandescent light bulb, you can have a 1-watt LED producing virtually the same amount of light, and so have a tremendous savings of electricity. Anyway, we are getting interested in LEDs, even though they were small light sources. If you brought the LEDs closer to your eyes, the amount of light getting into the eyes would be as great as if you were looking at a light box 3 or 4 meters away. And so we thought light boxes had been used in the past as light therapy devices, but they're very expensive, they're very large, they are not mobile, they have to be plugged into your power outlet, but LEDs can be driven by a little battery, a little tiny battery for quite a long period of time. And so they can be miniaturized and they can be built into some glass frame pointed at the eyes, and it could serve as a light therapy device. And so we were experimenting with LEDs, but LEDs only came in 5 or 6 different colors during the 1990s. We found one type of LED, an amber colored LED, that had very good light output for the amount of electric current. And so we tested those first. And we tested those by getting people exposed to the amber light LEDs in the late evening and measuring their melatonin output as measured in saliva. And we know that melatonin starts getting in the body controlled very finely by the body clock. And so it's very reliable that about 1 or 2 hours before your normal bedtime, melatonin starts getting secreted from the pineal gland in the brain as a result of instructions from the body clock here. And so you can pick up the melatonin in your blood plasma, in saliva, in your urine. Saliva is the most convenient, and good tests were constructed to measure the melatonin concentration in saliva. So that's what we used. And we measured the saliva across a normal nighttime period for a person. And then we administered this amber light at midnight for 2 hours. And we could see what effect it would have on the melatonin levels, which were starting to increase at that time. Would it suppress the melatonin levels through the circadian system or not? And would it have an effect to delay the body clock, because exposure to light in the evenings, we know from earlier studies, delays the body clock. We used the amber colored, and we were really disappointed to find it had no effect whatsoever. And so our attempt to create light therapy devices using these high intensity amber LEDs was a failure. But then we thought other colors must be effective, because we know that white light, which includes all the colors of the spectrum, is effective. So we thought, okay, let's test all the different colors. Amber wasn't effective. Maybe red wouldn't be effective either. But then there's the blue end of the spectrum. And so we used all the LEDs that were available at the time, going from deep blue to blue-green, green, amber, and red. So we used those 5 different colored LEDs and tested their effectiveness at suppressing melatonin when exposed in the evening, and its effect on delaying the body clock, because we knew that light in the evening would delay it, by measuring when the melatonin increased the first night before any light exposure, and then after light exposure, when melatonin showed its increase in the following night. That's called a delay of the melatonin rhythm, and that's been traditionally used as a marker of the effect on the body clock. And so we used all those 5 different colors very thoroughly on the same participants on 5 different occasions, compared to no light at all as your control condition, and found that the amber and the red LEDs had no effect compared to no light at all. So it was as if the circadian system was blind to the presence of amber or red light. So that explained why our initial negative findings with the amber. But we did find that the green LEDs, there was some effect at retiming the body clock. The blue-green LEDs had a very strong effect, as did the blue LEDs as well. So the blue and the blue-green in the shorter wavelength end of the spectrum had the significant effect. So that's where the significant effect from white light comes from, is from the blue and the blue-green areas of the spectrum. Now, subsequently, devices have been discovered in the eyes which are sensitive to those wavelengths of light. So it made sense of our findings. So the picture has now been tied together very nicely. And so we developed devices that use the blue-green area of the spectrum. We found that they were effective at delaying the body clock when light was administered in the evening, and advancing the body clock, that is, retiming to an earlier time when the blue and blue-green light were presented in the mornings, which was consistent with what was found with white light, but it's the blue and blue-green part of the spectrum which are affected. So we developed devices called ReTimers, which basically mounted LEDs onto glass frames that would direct light into the eyes and be driven by little batteries embedded in the light in the frames of the glasses. And so they were absolutely self-contained. And there were glasses that could fit over your normal reading glasses or spectacles, so they could be worn in conjunction with your own glasses if you had them or not. And they were portable, so you could just stick them on and walk around, eat your breakfast, watch television, work on the computer, or indeed fly across time zones intercontinental, preparing to help your body clock adjust to your new time zone that you'll be experiencing at your destination. That's a long story. And Nishi, you might want to ask some questions with regards to aspects of that.
Yes, no, thank you for sharing all of that. And I think our audience of clinicians will be really interested to know how to use this device, the ReTimer device. And I've actually got one here that I'll just show everybody so they can see what it looks like. So this is the new version, because I think the old version, like you were saying, it went over the glasses, but this one, I've got an open one here so people can see. It just sits on the face like that.
Yeah, well, it sits on your nose and so the light comes from slightly below to fill up your eye sockets with the blue-green light.
So if a clinician is interested in using this either for themselves or they may be interested in using this with their patients who have insomnia or mood disorders, could you speak a little bit about when should a clinician consider using this type of device?
Yes, I guess the example I focused on was that sleep onset insomnia. And in those cases, then the morning times, as soon as the person wakes up at their regular wake-up time, they should put them on, turn them on, and use them for at least half an hour. And that's usually enough time, although people tend to be rushed in the mornings. Use them for as much as you can before you leave home. Don't wear them while you're driving your car. I think that could be potentially dangerous. If they get to work, they could put them back on again if they're working at a desk. And most people these days seem to be working at a computer. And that's perfectly sensible to use them while you're working at your computer. They don't get in the way. They just provide an extra source of light. So if you're suffering from that sleep onset insomnia, no problems staying asleep once you sleep. Then it sounds like there's a body clock delay, which is best treated by using the ReTimers in the morning on a regular basis. So for at least half an hour, the more time, the better. And even on the weekends, even when people are trying to catch up on their sleep, not to delay your wake-up time by too long. Our research has shown that if you do that, it has the effect of allowing your body clock to delay, and that just exacerbates the problem of the sleep onset insomnia. So don't delay your wake-up times very much on the weekend, maybe half an hour to an hour at the most, but then get as much light as you can as soon as you wake up in the mornings after you're waking. Now, we've done some research with people with the opposite sort of problem, and this is more common in the older population of people who have no trouble falling asleep at all. In fact, they tend to go to bed a bit earlier than normal because they're just feeling so sleepy they're falling asleep in front of the television set at 8:30 or 9 o'clock at night. So their bed partner says, look, just go to bed. And they go to bed and they fall asleep within minutes, but then they wake up at 3 a.m. in the morning and they can't get back to sleep. We call that early morning awakening insomnia, and that's one of the insomnia symptoms that people report that have chronic insomnia. In those cases, we found that their body clock is timed earlier than normal, and they have been helped, and our research has shown this, by using the ReTimers in the evening before going to bed. And in the initial few nights of wearing them, if they stayed up a little bit later than normal, if they normally went to bed at 9 p.m. and fell asleep in 5 or 10 minutes, I'd suggest going to bed at 10, trying and struggling to stay awake a bit later and using the ReTimers for at least an hour during that time that they're awake in the evening, and doing that on 2 or 3 nights in a row, and then finding their comfortable sort of bed timing and using the ReTimers on a relatively regular basis in the evenings. What that will do is to delay their body clock, because part of their problem of early morning awakening is that the body clock is at 3 a.m. in the morning saying, oh, it's time to wake up. Like with most of us, it would be 8 a.m. in the morning. So for most of us, it's difficult to sleep later than about 8 or 9 o'clock in the morning. For these early morning awakening insomnias, that same time is 3 or 4 o'clock. And so we need to delay their body clock. That'll make it a bit easier for them to stay awake at 7 p.m. and able to then maintain their sleep until a later time in the morning, giving them more total sleep time. And so they'll increase their total sleep time and sleep at a time that they prefer to sleep. So those two types of insomnia can certainly be treated started with the ReTimers. And you mentioned seasonal affective disorder. I think people with winter depression. You wouldn't be experiencing much of that right now with daylight savings time and everything. But coming October, November, when there's less ambient light in the environment, there are a certain percentage of people that experience sort of winter depression, it's called, feeling a bit low, underperforming. The winter time is just not their best time. And the feeling is the main contributor to that is a delay of body clocks, their body clock. And the use of bright light in the morning has been shown to have some beneficial effects for winter depression. And how do you get that? Get outside in the sunshine. But if it's raining and cold outside, that's just not very conducive or convenient. And so some artificial indoor light is suggested, but instead of a big light box, the ReTimers can be used instead. Very convenient and less expensive. Morning use for people suffering a bit of winter depression is be helpful. Shift work is another possibility, but there's so many different types of shift work schedules, and it's probably preferable if people are on a rapid rotating shift schedule, so only doing 2 or 3 days at a time with a particular shift, and then changing to another schedule, and then changing to another schedule, and so forth, and then days off and so forth. It's probably better to maintain a secure body clock timing, despite the fact that on a couple of nights they might have night shifts. So the story isn't complete about how best to use light with shift work. The only exception might be people that are going to go on to a permanent night shift and they're just starting that permanent night shift. Then the use of the ReTimers in the evening to delay their body clock will be beneficial for them. We've just done a study of what are called people on submarines, simulating the situation where they are on leave, on shore leave, if you like, and experiencing a normal daytime awake, nighttime sleep pattern. And then they're thrown onto the submarine, underwater, no light exposure, very dim red light most of the time, and they have to work in a night shift situation. We've shown that bright light in the evening, going as late as 4 or 5 a.m. in the morning on several nights in a row, really adjusted them very quickly onto the night shift. So they're performing much better across the night shift and sleeping much better than during the day when they had an opportunity to sleep. So only in that we'd be more confident about suggesting the ReTimers for shift work if a person is going on to a permanent night shift and is happy to stay on that.
Excellent. No, that's really helpful. And I've found light therapy to be a very effective tool for my patients who are dealing with insomnia, coupled with CBTI, cognitive behavioral therapy for insomnia, and light therapy can be really effective. And of course, for patients who have circadian misalignments.
The other case that I haven't mentioned yet is jet lag. I don't know if you'd like me to talk about that at all.
Yes, please.
Okay. Some of your people would be flying across time zone from the West Coast to the East Coast or vice versa, and back and forth, or across the Pacific or across the Atlantic, or across 5, 6, 7 time zones sometimes, and experience jet lag, which comes from a desynchrony between their body clock and their destination environment. Now, if you're going to fly overseas for only a couple of days, maybe a business trip or a political trip or something like that, then it's probably not a good idea to try to shift their body clocks by 9 or 10 hours to accommodate that before they fly back again. And it's not going to be very successful anyway. It's always going to take some time to readjust the body clock, even with the best use of light at the right times. But people who are Olympic competitors and want to compete at their highest performance levels, business people who might be spending a week or two in a overseas destination doing business, or just tourists that want to enjoy themselves for 2 or 3 weeks overseas. It makes sense to adjust their body clock as quickly as possible, or even to do some of that adjustment before they leave, if that's possible. And using light at the right time is probably the most effective device. Melatonin has been suggested as well, and that does have some scientific evidence to support its use. It's not as strong in its effect as light at the right time, but in conjunction, both those things can work and facilitate getting over jet lag as quickly as possible. When you're flying westward, say from the United States to Asia or Australia, you need to delay your body clock to adjust to that new environment, a new destination. And that requires light in the evening before you go to bed to delay the body clock. And there are formulas that both the ReTimer company has and there are others you can find online, which I think are pretty reliable at giving you the time to use light therapy to facilitate that adjustment. And if you're flying westward, like I said, over 7, 8, 9 time zones, then using light in the afternoon and early evening before you want to go to bed is the best time to use it. That'll help to delay your body clock. But of course, if you're flying into the winter time or shoulder seasons, there won't be as much light available in the evenings. And so that's when a light therapy device like the ReTimers can be useful by using them from 6 p.m. on to when you want to go to bed at night. If you're going the opposite direction, eastward, then you need to shift your body clock earlier to make that adjustment. And for most people, that's a little bit more difficult. And using light in the morning when you wake up is probably the best advice in that situation. But again, there are formulas that you can consult to find the best times for using the light to make that adjustment depending on how many time zones you cross and the season that you're going into as well.
You were talking about individual differences in the body clock. Could you explain more about that?
Yes, I might refer back to what I was talking about earlier, when our body clock timing for sleep gets pushed into the nighttime and how that probably served as an adaptive function. And so we are left with it as a biological mechanism still. But you don't find many people asking the question, if sleep is in the nighttime, and that was adaptive for us, why does it tend to slip very late to the end of the nighttime? Most of us don't go to bed until around the middle of the night, midnight, and sleep until the sun is coming up. Why doesn't sleep start at sundown and go to 3 a.m. in the morning for most of us, which would be, just as logically possible, but it doesn't. It shifts later and stops around sunrise. There's a good explanation for that in that it turns out that most of us in the population, and a lot of people have been surveyed by this and run in experimental laboratory studies to confirm this, that most of us have a body clock that is not perfectly timed on a 24-hour basis. When we call them circadian rhythms, circa means about 24 hours. And that's a good terminology because most of us don't have a precise hour body clock. Most of us have body clocks that take a little bit longer to complete a cycle up, down, and back to the same up spot again. Time taken to complete a cycle is called the period length, but you don't need to worry about that. That is, the time taken to complete a cycle is around about 24 hours internally. In other words, for example, if people are put into experimental situations or in caves underneath the ground, they have no experience of time. They don't know what time it is. They can just be awake when they feel like it and sleep when they feel like it, eat when they feel like it. And experiments have been done to provide that. What's been found is that people's sleep period tends to delay a little bit every night. So say on the first night, they say, okay, I'll go to bed when I feel like it. When they feel like it turns out to be, say, 11:30. The next night, it turns out to be 11:45. The next night, it turns out to be midnight. The next night, it turns out to be 12:15, and so on. And so their sleep period gradually gets later and later by clock time, which is geared to the 24-hour rotation of the Earth. So it's the period length is a little bit longer than 24 hours. Now, so most in the population have a tendency to go to bed a little bit later if given the opportunity. And you see the opportunity on the weekend because you can sleep in the mornings. And we stay up a little bit later. And we sleep in a little bit later. That seems to be a natural tendency with most people. It's not true for everybody. That's just the average. So the average period length is about 24 hours and 10 minutes, but with a normal distribution around that. So there are some people that are exactly 24 hours, some people 24 hours and 5 minutes, a lot of people 24 hours and 15 minutes, some people 24 hours and 20 minutes. So it's a normal distribution. Some people have period lengths quite a bit longer than 24 hours. Some people have period lengths about 24 hours, and a very few people, maybe 1 or 2% of the population, have period lengths less than 24 hours. It turns out that those people that have very short period lengths, less than 24 hours, end up being what we call morning types. Like in owls or larks, they're the larks. They wake up, they bounce out of bed in the mornings at 6 o'clock and out in the sunshine. What a wonderful day. They're feeling good at that time. But at 9 o'clock at night, they're dropping quickly. And they don't like staying out. They don't like going out. They don't like socializing. Why? Because they just feel so tired, so sleepy at that time. They just rather go to bed. And they end up being also the early morning awakening insomniacs. So we have the morning types tend to be early morning awakening insomniacs and tend to have a very early sleep period. And then other people who have longer period lengths have a stronger tendency to delay every 24 hours. That's only held in check by being exposed to light on a regular basis in the mornings. So just imagine now the general population has a small tendency to delay. Some individuals have a stronger tendency to delay. Those people that have a period length of 24 hours and 20 minutes, let's say, they end up being evening types. This is a simplification, a generalization, but that's generally true. And they just feel much better in the evenings. They feel like death warmed over in the mornings. They don't feel civilized until at least 2 or 3 hours after waking up and 2 or 3 cups of coffee. And then they're ready to go, ready to meet the world at noon. And at midnight, they're ready to take on the world. They feel productive. They feel good in the evenings. That's because of their body clock. That's their alert zone is quite late. And so there are individual differences in the period length. And these probably are more or less genetically, very strongly genetically determined. So you're likely to be an evening type through your whole life, or a morning type. Most of us are intermediate in between, with a small tendency to delay our body clock. That also accounts for why most of the population find it easier to fly westward, because that requires a delay of your body clock, which is going with your natural tendency. Whereas going eastward requires advancing, shifting your body clock earlier, which goes against the grain for most of us. There are certain types that have a stronger tendency to delay, and they will be more likely to be sleep onset and sleep in late in the morning. Their greater tendency to delay means that their attempt, for example, to catch up on sleep they might have lost during the week because they weren't able to get to sleep until midnight or 1 a.m. Their desire to catch up on their sleep by sleeping in late means that they don't get exposed to morning bright light on those weekend mornings. So on Saturday morning and Sunday morning, for example. And not getting exposed to light in the morning means their body clock just delays by the amount it wants to, which might be an extra 20 or 25 minutes. And so at the end of the weekend, their body clock, as a result of sleeping in late, has delayed by up to an hour. So they have an hour more difficulty getting to sleep on Sunday night and Monday night and so on. So they go through that vicious cycle, losing sleep across the week, catching up on their sleep, but delaying their body clock, which is the major problem of their loss of sleep during the weeknights. For them to have light therapy on a regular basis in the mornings and not sleep in too late on the weekends, and getting light therapy as soon as they can on the weekends as well, would be recommended for them. So the majority of the population has this gradual tendency to delay. Some people much more strongly than others.
Thank you. And you may have seen my dog's tail going by. He has a
Was that
very...
your dog? I thought it might be a cat.
Yeah, no, that was my dog, and he has a very robust body clock, and he knows exactly when it's dinner time. His dinner time's at 6 p.m., and he got up at 5:59 p.m. kept telling me it was time.
All the organs of the body have built-in clocks that are controlled by the central clock in the brain to some extent, but they're also autonomous to some extent. And so I always remember a Snoopy cartoon, or a Peanuts cartoon with Snoopy, who wakes up and says, "It's breakfast time. My stomach clock had just gone off." And it's true. The digestive system has a clock to it that's linked to the major body clock, but it also feeds back to the body clock, says what time it is.
So fascinating. For the clinicians listening, there's loads of use cases for light therapy. And as I was saying, I use it a lot for people who are struggling with sleep, but also mood disorders, seasonal depression, even unipolar depression. I found it helpful in those cases as well, especially when those symptoms are coupled with circadian rhythm misalignments or sleep issues. So where can people learn more about ReTimer, and where can they learn more about your research?
They can go to my website at Flinders University, but just going to the ReTimer site, it's pretty well supplied now with information with all the research that's relevant to retiming the body clock and to the studies that have been done and are being done at present using the retimers in a large range of different studies. So they've got a big bibliography of published studies and ongoing research using them.
Wonderful. Thank you, Professor Lack, for sharing your knowledge, your research, and developing this incredible tool that is really so effective for our patients struggling with a variety of different types of conditions. So I do encourage all clinicians to look at the power of light and introduce some of these tools into your clinical toolbox, because there's lots of things that we can do to support people without relying on medications. So thank you again for joining me today.
A pleasure. Pleasure, Nishi.
I learned so much from Dr. Lack, and through this masterclass on circadian rhythms, it took me right back to my sleep medicine fellowship, and really enjoying all the lectures on circadian rhythm, body clock, light therapy. I just find this topic so fascinating. I'm curious to hear what your takeaways are. Let me know in the comments below. What are your biggest takeaways from this conversation? Do you use light therapy with your patients in your practice? Light therapy is such a powerful tool for sleep issues, for psychiatric issues. I use light therapy quite frequently for my patients that I see with anxiety, depression, and sleep issues, and it's a really underutilized tool, I think. So you can consider using the ReTimer. This is the new model that's just come out. I do have an affiliate link, so I'll put that in the video description if you want to check it out. Of course, sunshine is really the best treatment. I was chatting with Dr. Lack about that afterwards, that exposure to sunlight is the most powerful way to get light therapy, but it's not always accessible to our patients depending on where they live, on the weather, and some people are just not doing it. And so in those cases, this is where technology can be be really useful. If you found this video helpful, go ahead and share it with another clinician in your life, and I will see you next time.